So Professor Bashkim, you will give the introduction for this session. This is the ninth session of the Global Oncology Implementing Science that belongs to all. And we are proud and we have the honor today that this session is combined between University of Titova, Professor Bashkim, and Professor Susanna, Dean of Faculty of Medicine, Pristina, Kosovo, and she is also the president-elect of a very important group, Mediterranean Task Force for Cancer Control. So she will give us also a hint about these important initiatives and the link and everything. So, Professor Bashkim, if you kindly open this session, and thank you.
So, dear Ahmed, thank you very much. Thank you very much for everyone being part of this session now. To our students, to distinguished leaders and contributors of the Global Health Catalyst, welcome all in the 9th session of the Global Oncology University Implementing Science course. As Professor Ahmed already made some short introduction, it started like 8 sessions before. Now this is the 9th session, and it will go until summer next year, probably.
Yes, till June.
June, yeah, of the next year. So thank you everyone for being present here, especially also thanks to Michaela from Romania. Hi, Michaela. Nice to see you. We are working with Michaela and with Saiful together now in applying in 2 different projects, EU projects for residency in medical physics. So we see that already the fruits of the global health networking of participants from all over the world. And now I see also Will has joined us. Hi, Will. Nice to see you. So please, Mahmoud, give rights to Will to open his microphone and to say a few words before we start with the presentations.
All right. Yeah. Hello, everyone. Can you hear me?
Yes.
Yes. Hello.
Yes.
Yes. Sorry, I'm joining late. I had some issues on my Zoom, but yeah. So welcome to everybody. Thank you, Bashkim. So I just wanted to really appreciate you joining this course, obviously being one of the leaders for the win-win movement in the Balkan area, and also being able to invite Professor Susanna to join, who is very well accomplished, as the dean and also the vice president of the Mediterranean Task Force for Cancer. So we couldn't be more honored to have somebody such distinguished participation today. And obviously our friend Michaela. So like you said, we're really excited about this opportunity that you can talk today about, the challenges on cancer in the Balkans, but also about the opportunities. I know Professor Ahmed always likes us to move from, just talking about the challenges to the solutions. And I think that you and Michaela, and obviously Dean Susanna are already working, this kind of collaboration that you're already creating is towards developing solutions that can really be sustainable and win-win. And one of the big ways, obviously, is capacity building. And so, we look forward that after this meeting, we can actually really build on the webinar today, to kind of, build more solutions and really do some activities, transition from the talk into some action that can really benefit, the regions in the Balkans. So really, really excited. Obviously, I've known Professor Bashkim for a while. He's my friend. He and I went to Germany, University of Leipzig together. And we were the leaders, so the best, I would say the best trainees in the physics program there. And then he's been a really clear founder of the Global Health Catalyst Win-Win Initiative and the Global Oncology University, and was with me at Harvard in 2019 when he visited as a Fulbright fellow. And so we're very excited that he's staying true to his actions, true to his words in being able to catalyze collaborations in the Balkan area. So really looking forward to this session, and just thanking all the participants for joining today for this very exciting presentation. And over back to you, Bashkim.
So thank you very much, Wilfred, for kind introduction. Of course, we know each other, but we didn't stop only to knowing each other. We spread the word, and we spread the friendship and the collaboration also to other friends that we have now here and all around the world, that we are working together, as we usually used to say, hand on hand together to with the same goal to increase the quality and affordability for cancer care all over the world. And that was on one of the aims during my talk that I had during my presentation and greeting that we had a few days ago when we presented. I was part of the Kambai, let's say, platform that was introduced in Bangladesh a few days ago, and it was also there amazing that the people are coming together from the different institutions from different areas of the society, trying to do something for the benefit of the society at all. So now I will start with the introduction from my side here. Let's see. Make a screen share. If I can do screen share. One second, please. It is something basic. It seems I cannot do screen share for the moment. Let me try once more. I don't know why we just tried and it worked, but now seems some difficulties to have. Well, it seems I cannot do screen sharing for the moment. Let me see. Yes, now, thank you, Mahmoud. You made me a host, so I can do now screen sharing. I hope everyone sees my slide now.
Yes.
Thank you, Mahmoud. Mahmoud is for the technical support by Professor Ahmed. So I will try very briefly to give a kind of what is the situation in our region, especially in the Balkan countries, for those that are coming from outside. A small, let's say, info. Where is the Balkan situated? This is Europe, and Southeast Europe, but mostly in the southern part of Europe are the Balkan countries. Usually there are like 6 or 7 countries that make the Balkan Peninsula. And then in this part of these Balkan countries is also North Macedonia. Republic of Macedonia. This is old, but in the meantime, we are our official name is Republic of North Macedonia. And here in the northwest is the city of Tetovo, where I'm situated here, the city, and this is the University of Tetovo, where I'm working. So this is a small introduction of the regional, that only to have a feeling that we are coming from different regions of the world. But as we will see, we have similar problems that with the joint forces, we can work and fight against challenges that we have, especially cancer cases. So when we are in the cancer cases, why we are let's say dividing the region from the rest of the Europe is because if we see on this data here, we will recognize that in the region here, we have more difficulties in the cancer care compared to the rest of the Europe. And this is these are some scientific data, because as Ahmed said, the idea of global oncology implementing science course is to show that supported by the scientific data, we can work together to let's say, address the issues and problems that we encounter. This is a table. This table is a little bit difficult to understand it, but if we come here now, we will see that because in this table here, we observe that the incidence rate in Western European countries, in more developed European countries, is higher, but the mortality rate is lower, while in the in Western European countries, while in the Southeast Europe, the incidence rate is higher, but the mortality rate is lower, but the mortality rate is very high. That there is a discrepancy. We'll see on hand of the graphs also later. Here's a graph about the health expenditure per capita, and all these countries in the red here are the Southeast European countries. That shows that also the health expenditure related to mortality to incidence ratio is high, and also the health expenditure is very low. That means these two things should be connected or are connected when it comes to cancer care. And this is also the case with the ratio for all cancers here for Western European countries here in the green and yellow, and the Southeast European countries. Expenditure per cancer case, in fact, it's also very low in these countries compared to the West European countries. So one issue that we have to address when we speak about the problems that we have in Southeast Europe is obviously the expenditure, the investment that we do for a better cancer care. But as we will see, this is not all. We have also other difficulties that should be addressed. Now, if we see the incidence, the cancer care incidence here, let's say incidence and mortality rates for Western Balkan countries and the average of the European countries, we will see that in general, the mortality rate is much higher than in the Western European countries. So we can compare this in this table here that we already have published in chapter 30 of the book that we published together with many scientists and contributors from all over the world. There you can find this table, and in this table, for example, it shows that the incidence rate in Balkan countries is lower than in Western Europe and the European countries, but the mortality rate is much higher. In Europe, in average, is 45%, Western Europe is 40%, and in most of the Western Balkan countries, it's above 50 or 60%. That shows it's much higher. And also this is related to healthcare expenditure in general for the healthcare system. And in this case, we see that in the Balkan countries is much lower than the European average. And this is also shown in this table here, where most of the average EU expenditure is 7.9 was in 2019, and in Balkan countries it's much lower. Now, when it comes to Macedonia, North Macedonia, these are data from the Institute of Public Health taken. We have the cancer cases, new cancer cases in the interval 2012-2021, that we see that we have all the time an increase of the number of new cancer cases in both in male and female, although cancer mortality in male is higher than in female, and mostly due to the lung cancer that's related to probably to the smoking in the male population. And now it's the percentage of cancer care occurrences for 10 years averaged. And we see that in females, the most common cancer case is the breast cancer. And then we have the other types of cancer. When it comes to males, or again, averaging over 10 years, we have the lung cancer that is most present in the male population during this 9 years from 2012 to 2021. Now, when it comes to the resources that we have in the country, these are the data given. I will not go into details. What I will go into a little bit to describe is because we know that more than 50% of cancer patients do radiotherapy. So in the country, we have 3 LINACs that are in the main hospital, Mother Teresa Hospital in Skopje. And then we have also 3 LINACs in different regions in the country, but they are not working. These 2 LINACs in Stip and in Bitola, these are not working because we don't have the adequate professionals and physicians that will work in these centers. So this is a big issue for our country because we have a large exodus of physicians that go in the Western European countries. Now, the next point is the awareness and early detection programs that are very important for most of the cancer types in order that we decrease the mortality rates in our region. For example, this is a screening program for cervical cancer in our country. And if you see the data, it's amazing that 74% of people in my region, 74% of the women in my region, they didn't use this screening program for cervical cancer early detection. Another issue is, for example, when it comes to the vaccination. In our country, all young girls have the possibility to get a vaccine, HPV vaccine, but especially after the COVID, only 35% of the girls used this possibility to take the vaccine. And this shows that there is a huge gap and a huge possibility to work together in terms of awareness and let's say convince the people, for example, for HPV vaccine that is not against fertilization, but it's against really saving lives. Another, let's say, early training and early education of young young students that will be future professionals in the field is the masterclass, particle therapy masterclass that we are having in our country. It's part of the international masterclass that is being held in more than 50 countries. And we are doing this event yearly. Next year, we'll do it 2 times in our country. So there is a huge interest from high school students to participate in this kind of training where they get some lectures and then also hands-on. They do it by themselves using different types of beams to build a treatment planning for different types of cancers. When it comes to public awareness, we have only 2 profiles here that are Facebook profiles and that are working in cancer care prevention. It's not enough, really. We should do more in this direction. We had the October month, that was the breast cancer October month, and we worked here with high school students to advertise the early screening and controls against breast cancer in the population here in the city of Tetovo. And the next point is, of course, the infrastructure and diagnosis tools that are very important. There is a recent study here from 2022 that shows that in Southeast European countries, especially in the Balkan countries, the number of, let's say, CT mammography machines or MRI, PET-CT, and so on, it's smaller than in most of the European countries or the West European countries or the European Union countries compared with the Balkan countries. That shows that we need a higher investment in this direction in order to have a better access to these machines. One big project that we are working together is, of course, instead of using usual machines today, they are using photons for radiation. And instead of using photons, we want to use protons and carbon ions. And therefore, we have a consortium of 9 countries working together here combined inside the SACE project. And the idea is to build a proton machine and a carbon machine in one of the countries. And we are well in time of choosing the place where this center will be built. Because there are a lot of such centers in Western Europe, but none in the region here in Southeast Europe. And therefore, the idea is to have such a center that will, especially for young cancer patients, will be very beneficiary. And this is now the description here. I will not go into the details here. That's the center looks like. Different partners are involved for the construction of this center. And this is the roadmap of the center, and we are hoping now here, maybe 2023 not, but in 2024, we are hoping to start with the construction of this new center. And of course, also other participants, also member countries, will benefit from this center. They will have their own science hubs. And all this that I try to discuss a little bit is given in this book and in the recent book that we have published together. That's a combination of all these 4 pillars: education, care, research, publication, and all that contribute to each other. And then we are all together working for a better cancer care treatment and availability. So here I have stated some of the demands here, but because of the time, this talk will be is recorded and will be online for all those that are interested. So also the demands and the recommendations will be part of the talk that will be very shortly after the session. We'll distribute it to all participants online and all over the world that can have the chance to see the presentations once more. And also will feel free to contact me. So with this, we're thanking all the people here, and I apologize for some of those that I have forgotten, I haven't put it in this acknowledgement. And thank you very much, all of you, for listening to this presentation. So this was my presentation. Now, Professor Ahmed, you are muted. You are muted. So.
Okay. So please now, thank you very much, Professor Bashkim. And now the floor for Professor Susanna. She is not invited, by the way. She is one of the co-author of this book, and she is one now of the leaders of the Win-Win Initiative and all this group. This group, our group belongs to all, and we need all. The challenge is too huge. It needs all of you as leader and the participant too. Please, the huge is very. The challenge is very huge. Now, Professor Susanna, introduce yourself, and please introduce also the Mediterranean Task Force for Cancer Control, and that you are the president-elect.
Okay, hello everybody. Do you see my presentation?
Yes.
I'm trying to put it in a slideshow. Okay, so dear colleagues, ladies and gentlemen, my name is Susanna Mangiuca-Cârliu. I am a pathologist, a professor of pathology, dean of the Faculty of Medicine, University of Pristina, as well as president-elect of the Mediterranean Task Force for Cancer Control. Actually, Kosovo is making great efforts in terms of intellectual, professional, and collaborative communication with the national and international level in order to strengthen cancer control with the main target to reduce cancer burden. Actually, cancer is the big calamity of the centuries. According to latest global cancer data, like Global Can 2020, cancer burden rises to 19.3 million new cases and 10 million cancer deaths. And according to WHO and other global organizations, number of new cases in 2020 for both sexes and all ages is leading with the breast cancer, proceeding with the lung, colorectal, prostate, stomach, and other types of cancers. And in regard to number of deaths, lung cancer is the first one, proceeding with other types of cancers. And Kosovo National Program for Cancer Control objectives are cancer registry, cancer prevention, screening, and early detection, as well as cancer treatment with palliative care. According to UICC, cancer is a leading cause of death worldwide, with 10 million people who died in 2020. That means 1 in 6 deaths worldwide. This is the World Cancer Declaration with 9 targets that are supposed to be achieved by 2025, like strengthening health system for effective cancer control, measure cancer burden and impact of cancer plans in all countries, reduce exposure to cancer risk factors, universal coverage of HPV and HBV, reduce stigma, universal screening and early detection programs, universal availability of pain control and distress management, improve of education and training of healthcare professionals. And Kosovo has made a great success in regard to cancer declaration targets, taking into the consideration the limitation of the budget for health. Services that are offered at the oncology clinic at the University Clinical Center of Kosovo, that is the only one in Kosovo, are systemic treatment like chemotherapy, targeted therapy, immunotherapy, and then hormonal therapy in 120 to 150 patients per day, radiotherapy for 150 to 170 patients per day, brachytherapy for 12 to 15 patients per month, and all these services are offered by only 13 medical oncologists, 6 radiotherapists, and 4 residents. The most frequent cases of cancer in Kosovo are breast, lung, and colorectal cancer, similar to other countries. It is important to stress that it is increasing number of new cancer cases in Kosovo due to young population. And unfortunately, it's still ongoing trend of new cancer cases on late stage of disease, besides increasing rate of new cases in early stage. As far as for new cancer cases in Kosovo for this year is concerned, breast cancer is leading with 412 new cases, proceeding with lung cancer, GI tract cancer, urogenital cancer, and others. And in total, almost 2,000 new cancer cases for this year. And now let me inform you about the GOIS HPV collaboration project. Actually, Kosovo is a part of a multicentric study, so-called vaccine optimization in cervical cancer everywhere. It is a partnership between the Norris Cotton Cancer Center at Dartmouth, United States, La Liga Cancer Center in Honduras, the Ocean Road Cancer Institute in Tanzania, and the University of Pristina in Kosovo. The coordinator of this DNA-based molecular study project is Dr. Gregory Songalis, who is director of the Center for Clinical Genomics and Advanced Technologies at Dartmouth Hitchcock Medical Center in collaboration with Norris Cotton Cancer Center. And this project is supported by NCI in the United States. I'm a coordinator for Kosovo side. This is the center that I mentioned, and Dr. Gregory Songalis and me visiting this center. And this is part of the collaboration that we have as a Faculty of Medicine, University of Pristina in Kosovo, with Geisel School of Medicine, as we agree to deans of each schools. The purpose of this study is to collect and analyze data to inform local public health policymakers concerning optimizing population-based HPV vaccination. With this international team, we are prepared to leverage our differences and strengths to develop a better understanding of the high-risk HPV subtypes, which place women at risk for cervical cancer. We compare HR-HPV frequencies in each country, elucidate the subtypes of HR-HPV that most frequently progress to cervical cancer. This is a well-organized targeted study that has the great benefit for our country, as well as truly circling the globe by comparing the United States, Tanzania, Honduras, and Kosovo. Our involvement in this project will build in-country research capacity and link us to other very different low-middle-income countries in the world that are, in terms of ethnicity, very distinct. As we know, nearly all cervical cancer are caused by high-risk HPV. And the evolution of HPV vaccine began in 2026 with a quadrivalent vaccine that was protective only for 2 high-risk subtypes, 16 and 18, to proceed in 2014 with a vaccine that was is protective for 7 subtypes, including 16, 18, 31, 33, 45, 52, and 58. So this is a very important HPV screening initiative in Kosovo, and we have collected 2,000 cervical swabs and 200 cervical cancer paraffin blocks for this study. So far, 863 cervical swabs were screened in the United States. 3 of the top 5 genotypes in this Kosovo cohort comprise around 90% of cervical cancers worldwide, which supports a geographic distribution of the most common high-risk genotypes. We know that HPV-related cancer, especially cervical cancer, are among the most prevalent forms of cancer in women around the world. In low and middle-income countries, cervical cancer is the primary cause of cancer-related mortality because the disease is frequently identified, unfortunately, in advanced stages. Over more than 5 decades, countries with higher resources have greatly reduced death from cervical cancer by widespread adoption of screening by Pap testing, and more recently with the addition of HR-HPV detection assays. In low-middle-income countries, adult women do not have access to HPV vaccination except by personal payment at private clinics. So our hypothesis is that the prevalence of HR-HPV subtypes as found in screening of normal healthy women will vary by location. And similarly, the subtypes of HR-HPV causing cervical cancer. In Kosovo, there have been undertaken different national screening programs like mobile mammography project, and this service was offered to women in Kosovo in more than 350 different villages that are inhabited by minorities, including Raya community. There is also ongoing a national screening a cervical cancer screening program by Pap testing in different municipalities. Now let me introduce you Mediterranean Task Force for Cancer Control, in which I have been recently appointed as a president-elect. In this organization, there are different countries of the Mediterranean region and beyond, and this is like an independent NGO by unconditioned member support with a mission to reduce the incidence of advanced disease through prevention and early diagnosis, and unifying efforts like updating knowledge, increasing health literacy, and promoting decrease of cancer burden. These are MTCC priorities and actions that we have undertaken in order to address these objectives through information, through education and training. We have prepared multilingual primary and secondary prevention brochures like leaflets for regarding the risk factors for most common types of cancer, as well as nutrition related to cancer. And these are translated in 12 languages of the Mediterranean region. These are distributed to population. And MTCC is updating knowledge now beyond the Mediterranean region, contributing to faculties and supporting fellowships. And given that cancer has been recognized by the United Nations in 2013 as a global emergency, prevention and early diagnosis are recommended as priority strategies. The question is, why unconditional support to primary and secondary prevention? It is because epidemiology is changing, widening gap between life and health expectancy. In terms of, in regard to science, cancer is mutation driven, not by chance. And in terms of global vision, it is an ethical, political, economical issue. And MTCC since 2005 is trying to decrease health disparities because equal access yields equal outcomes. And the question is where to start from. It should be started from GPs, nurses, because they represent the first-line cancer disparities fighters, because they are aware of patients' and family medical records, living environment, occupation, health literacy, economic status, and they can accelerate the diagnosis at early stages by returning to specialized centers in order to reduce advanced disease, because advanced disease is the devil of any treatment. Furthermore, they contribute in increasing public awareness, advocacy in the community, advise health authorities in prioritizing policies in rising health care costs. MTCC field actions for GPs since 2010 have been organized in different parts of the different countries of the Mediterranean region with new strategies, challenging students to develop their prevention messages, engagement of parents in school awareness programs, workers benefit from attending awareness programs, use of consumers' products with the motto, don't fear the smear, be informed, be screened, be vaccinated. And so according to MTCC, we are winning cancer as a laboratory, but not in the real world. Therefore, the medical system should work closely with public and private specialists and with the real world, involving environment, working place, cancer advocacy with survivors, schools, health literacy, worship places, philanthropy, as well as political parties. MTCC has organized in the Balkans in 2019 a conference, in particular in Northern Macedonia, on early occurrence of colorectal cancer with the aim to raising awareness and changing the perception. I have presented the rising incidence of colorectal cancer in young adults in Kosovo. Given that colorectal cancer in young adults, according to American Cancer Society, is increasing, and the American Cancer Society has lowered colorectal cancer screening at age of 45. Colorectal cancer incidence for young adults is low in terms of absolute incidence, but it is increasing over the time. Colorectal cancer in young adults has a tendency for distal location, rectum and left-sided colon. Therefore, future studies should seek to increase understanding of this distinct tumor biology of adolescents and young adult patients with colorectal cancer. This graph represents the increasing incidence of colorectal cancer before age of 50 in Kosovo. MTCC has, we as a MTCC have attended different international activities for global cancer control, like organized by GOIS, like World Cancer Leaders Summit, World Cancer Congresses, and we had a special session during this summit as MTCC. Also participated at Breast Cancer Europe Roundtable, organized by European Center for Parliamentary Study. And the last but not the least, the question is, what do we have to do to combat cancer? And the answer is that we have to work together, acting across countries, collaborate with different groups, raise funds, raise public awareness, educate people, make a plan, and understand the importance of the problem, because knowledge is power. And at the end, I will finish my presentation with the quote said by Kofi Annan that says, whether our task is fighting poverty, stemming the spread of disease, or saving innocent lives from mass murder, we have seen that we cannot succeed without the leadership of the strong and the engagement of all. Thank you for your attention.
Thank you very much. We have to applaud, really. Thank you very much.
Okay.
You hear me?
Yes.
Yes, yes,
okay.
Yes.
Thank you very much for this outstanding presentation of Bashkim, an outstanding presentation of Professor Susanna, really. And I would like to repeat that it is not just a presentation and finished. It will be a YouTube, a video. It will be in our web, so it will be available for all if you would like to increase, and for all participants now and in the future who would like to ask your colleagues to join the web and to see, and they are free to send feedback, because we can't say the complete things or perfect things in few minutes, but there is feedback, there is discussions and everything, and all of you are leaders. Also the participant, all of you were leaders, because there is a huge challenge. I'm really very happy with this excellent presentation. Now I'll run my recorded lecture would be for 15 minutes. It's coming. Hello. I am glad that that I am among you today in the ninth session of the Global Oncology Implementing Science course program at Global Oncology University. We are honored and glad that this session is combined with University of Titova, North Macedonia, and Faculty of Medicine, University of Pristina, Kosovo. We share the slide here. And we Professor Bashkim Zebri, University of Titova, North Macedonia, Professor Susanna Kirliu, I hope that I pronounce the name well, right? Dean of the Medical Faculty, University of Pristina, President-elect of the Mediterranean Task Force for Cancer Control, Professor Wilfred Negwa, as you know, and me, Ahmed Zawawi. The title today is Notions and Needs to Global Oncology and Global Education. We tackle shortly points about these notions. I am, as you know, I am Professor Ahmed Zawawi, Chair of Win-Win Initiative, Chair of Board of Directors, Global Oncology University, Founder and President of ISDOC, International Campaign for Establishment and Development of Oncology Centers, Past President of Aortic, Professor of Clinical Oncology, Suez Kinal University, Ismailia, and Chairman of Al Suleiman Radiation and Clinical Oncology Center, Port Said, Egypt. This is based on this short lecture based on chapter 1. Access is free for all. You can, for this chapter, you can this is the link, chapter in our book, Approaching Global Oncology, the Win-Win Model. The access to the front matter, including the book summary, are free for all. And the first chapter. Disclosure of conflicts, none. As you notice that in most of our slides, that the text is not short with few words online, because as much as possible we add some references, and also we use the PDF material of slides for all who would like to receive a copy. So it will be text also. So please send to us and this is the link to if you want to receive a copy. Along also, and I note that along as we say always, the GOIS program in this short lecture, we don't transfer some information in a passive way, but also we raise brainstorming points. So the feedback and positive interaction are welcomed. And we encourage to receive from you all your feedback, suggestions, ideas. All your feedback is considered. The summary of some selective feedback will appear in next edition or new books or courses, with setting the names of the sender and surely after your permission. As we agreed together in the Win-Win Initiative and the Global University, Global Oncology University, we adopted the flexibility of free flows of ideas, classic and innovative approaches, and that all be focused on our sole objective and goal. Scientific is focused on scientific and practical implementation in order to serve the goal, the sole goal of us to increase the affordability of better value cancer care in the real world via science and win-win scenarios. The definition of oncology, according to Merriam-Webster, is a branch of medicine. I stress on this point. I would like to receive from you also your comments and feedback. Is a branch of medicine concerned with the prevention, diagnosis, treatment, all modalities of treatment, and study of cancer. Global, then it is mean worldwide. So global oncology doesn't mean as frequently thought that is cancer care and control in low middle income countries. Otherwise, it would be called low middle income countries oncology, but it's not like this. It is global oncology. This doesn't mean that one solution fits all. Cancer care should not be only customized according to biological markers, but also to the condition of the community where patient lives, their expectations, their own expectation, hopes, and culture. Here is a reference. Okay. Sometimes there is confusion. This is a very important point. Also, please discuss it as you wish. There is a confusion between the science of global oncology and the general public health topics and talks. The advocacy and public talks about cancer, despite the latter, are mandatory, but it is not necessary to be done by cancer care experts and cancer researchers. Despite of declarations, publications, plans, conference, commission, and international agendas and summits, the gap between the required and the available cancer care, between the available and the affordable, between the available and required, become and the affordable cancer care are widened in the last 2 decades in the world, and maybe in the last 3 decades also, surely. There is no indication that the gap will not be more wider in the upcoming years. It's very, we have to notice this. There is no indication, despite of many declarations. In addition to the skyrocketing in new cancer drugs and the total cost of cancer care, the lack of the foreseen remarkable increase of radiotherapy and medical oncology service in the world, there are, among other causes, also the increase of in cancer incidence and prevalence in low middle income countries, partially due to increase in population, increase of life expectancy, lower mortality due to communicable in comparison to non-communicable diseases, and change of lifestyle. It is worthwhile to note here that about just one example of skyrocketing rise of new cancer drugs, that among 13 new cancer drugs, the average price is in United States is $275,000 US. This is more than the average income of a citizen in California. So we can compare also with other states in the United States, and also in what is about the low middle income countries. You can imagine how it is skyrocketing. This is just an example. And these new drugs. The Win-Win International Scientific Initiative aims at the increase of affordable, better value cancer care in the world by scientific approaches and the win-win scenarios that consider the interest of all stakeholders. It should be like this: all will win. Hence, there is a great need for wide education and training program focus on how to enhance the human capacity that adopt and lead the scientific movement to increase affordability of triple value cancer care for millions of cancer patients with dignity in the real world. It is a scientific work. It needs wide education, virtual education, plus also we have some on-site training in some occasions. Global Oncology University, the Virtual Oncology University, is an example of collaborative model that could contribute in serving that purpose in the world. Starting in 2017, the Global Oncology University held a virtual course in radiotherapy, introduction global oncology, medical radiation physics, surgical oncology, and clinical trials. Even the surgical oncology was led by Professor Ricardo Odisio, and there are on the web available if you like the course of 15 lecture done by Professor Eduardo Gazab, Professor Ricardo Odisio, and in cooperation with and done by the European Society of Surgical Oncology. We are in what we present is model of collaboration, cooperation, and coordination with all. It is a forum for all. At present, there are ongoing courses. Among them is the long programs of courses of global oncology implementing science. The first ongoing course contain short 90 lectures, video, and live panels. The registration is free for all. Please visit our web. The question is that scientifically feasible to lower the total cost of cancer care without compromising the outcome on patient? Yes, yes, yes. Going forward, fruitful cooperation. You'll find many exciting examples. In the Win-Win Initiative at the Global Oncology Science, GOIS, Global Oncology Implementing Science course, we present in this program, we present and openly discuss tens of published scientific examples that could lead to lower the total cost of cancer care without compromising the outcome on patient. We are presenting published examples, and many, and not talks, or even to get better value of different fields of cancer care that include systemic cancer therapy, surgery, radiotherapy, repurposing drugs, devices, and medical equipment. Valuable input from leading industries. There are lectures and discussions with input from leading industries and important editors and editor-in-chief. We have an exciting scientific program contain all these that will particularly the period of January to April after 2 weeks. So there is an exciting program. Welcome all. Your input and feedback are deeply appreciated and very needed. Also presents real-world example of success and collaboration initiative in different continents. However, to provide approaches to expand, moreover, to provide approaches to expand the number and value of the offered cancer care and the win-win modified blue ocean strategy. What is this? What entails? It entails an enormous increase of the opportunity to expand service via global win-win models of coordination and cooperation. Once again, all will win. We don't claim that all these approaches are exclusive or final solution. Nevertheless, it shows that there are unlimited approaches for all, for scientific study and researches that could lead to lower the total cost without diminishing cancer treatment outcome. Moreover, more feasible efforts be done in the real world to expand enormously cancer care service in the world within many win-win scenarios and models that consider the interest of all stakeholders. According to the win-win notions, the endeavor is not replacing or competing any, but is complementing and collaborating as a forum for all. The initiative belongs to all and surely to all of you. Please join, contribute. It is a message to of love to all, but not in words and declarations and talks, but it's expressed in presenting scientific approaches in the real world that would assure more affordability of better value cancer care for millions of cancer patients in the world. All feedback, suggestions, and contributions are welcome. On behalf of the leaders and distinguished faculty, we thank you all and going forward in fruitful cooperation. For further reading and access to more relevant examples, please visit our website. And I finish here, and I would like to say that our perspective and our future and our success is for all of us. We are just and this initiative belongs to all and belongs to you, and it counts. We count on cooperation and collaboration and the leading of all going forward in fruitful cooperation. Thank you all. Okay. Now, I would like to hear if some of our dear colleagues, the participant, would like to interfere. Could you open for Michaela? Pronounce it well, right, Michaela? From Romania.
For me, it was a surprise to see Bashkin announcement on Facebook, and I wanted to see what's happened here. I'm interested to develop some things in Romania, and for this reason, we have a meeting every week with Professor Saiful, with Bashkim Ziberi, Professor Bashkim Ziberi, sometimes with Will. In generally, I think that we should improve the education, because we can change things in our country only through education. So we should become better professors, better leaders, if we want to have a future generation of professionals in this field of cancer care.
Thank you very much. But thank you very much, and I would like to consider that you are from this moment and your colleagues part of this international initiatives. It belongs to you, not to us. It belongs to all of us. Thank you. Thank you. And I count on Bashkim to connect us with emails, our website, and to forward everything. Thank you, and Professor Susanna, surely. Now I would like to hear from Abba, if possible. Abba.
Hello, Professor Al-Zawawi.
Hello.
Yes, indeed, it's really very inspiring, and global networking and looking toward on a different part of the world, how they work, sharing it, especially with the low middle income country, the challenges we have here in the European part. Seemingly, we are completely not left behind, so we can learn a lot from them, and we can be able to join force together with collaboration, completing the gap that we have, and we can be able to use the platform of the Global Oncology University and this platform in order to enhance collaboration for better service delivery, as well as improving our clinical evidence base in our locality. So it is indeed a very great platform for us to join, and we will encourage the young one to join more in order to spread the win-win collaboration. Thank you.
Thank you very much. We need you in the when we restore activity in 3 January. because there will be hot subjects about radiotherapy, about molecular radiotherapy, about pharmacology, about radiobiology, about many specific things. Will be start in January, and we need some points are it's brainstorming. Really, it needs our discussion, and it needs our your feedback. It's not just finished by the lecture. Now I would like to hear if it's possible from Viviane. Viviane, are you there?
I'm here. I just I wasn't planning to say anything, so, but it's all good. I just, as always, I'm here in the background, cheering everybody on. It's an honor to be a part of this team, and whatever I can do, I will keep doing to just elevate and highlight and profile all these voices on media, on different platforms whenever I can. So keep up, and happy holidays to all of you. You can always count on me. You know how to find me.
Please introduce yourself more with the important task of you as a media.
Right. So for those who don't know me, I am called Viviane Kopsinger-Birchall. I have been a part of the GHC family since I think 2018 in different capacities, but my one area that I thrive in is just talking to people, asking questions, and also showcasing the work that is being done in the global health platforms and networks through the GHC through videos and interviews and pictures. So I don't know what else you wanted me to say, but it's been a pleasure so far working with the GHC team for these years, through the years in different capacities. I'm learning so much, and just like you've mentioned, Dr. Ahmed, everyone has a role to play, be it just media, and this is where I come in, just to share and simplify some of the messaging around the issues that are very complex into consumable content for the general public, because we are all stakeholders, and cancer affects us all in different ways. So that's it.
Please do. We count a lot on you. And you are resident in United States, right? Please.
Thank you,
Okay.
Doctor.
Okay. Now I would like to hear from Professor Adel Ataya, if he is there. Adel Ataya. Do you hear me, Professor Adel Ataya?
Yes, thank you very much, Professor Ahmed, for inviting me. And I hope that, yes, I can hear you.
Okay,
we can hear you.
Introduce yourself.
Yes,
please introduce yourself. Yes. Please introduce yourself and your role in Benghazi.
From Benghazi, Libya. I am a consultant oncologist. Yes. I am a consultant medical oncologist in Libya, Benghazi. I am the coordinator of National Cancer Control Program in Libya, and the director of Benghazi Cancer Registry also.
Thank you.
I am happy to be with you in this project.
Thank you. And we are also, now we have to finish our article together, Cancer in North Africa, for the Lancet Oncology. Our friends, yes, we have to finish it. Okay, so who would like to, there are many really kind participants today. So I would like to listen from all who would like to join. Okay, from from Taufik, Professor Taufik. Taufik.
Yes.
Yes, we
Hello.
hear you.
Can you hear me?
Yes, we hear you well.
Okay, well, it's telling me that the host is not allowing me to unmute. Thank you again. You know, I actually look forward to this talk today, and I'm really very glad again that some of my younger colleagues that are even just informed us just late as yesterday, I find quite a number of them on the call today, which is really very pleasing to me, you know, which shows that just like you have been trying to espouse, you know, that we need to bring in the younger generation into this cancer space, you know, shows that the sky is just it's not a limit, it's just the beginning, you know, of the more thing that we need to do. I'm really very glad. Thank you very much for the two presenters today, Professor Bashkim and the dean from the medical faculty in Pristina. You know, I think those talks are really very interesting, and particularly listening to both of you, despite the fact that probably you're very close to Europe, we can actually see that we aren't too far off, especially listening to Professor Bashkim last week. I'd actually look forward to this talk, you know, and the LMICs, I mean, is not entirely consigned into the dustbin at the end of the day. And with this kind of collaboration and sharing knowledge, we can actually get things to move further. I was really not pleasantly surprised, you know, but shocked, you know. I mean, some of the situation that Professor Bashkim brought forward today with some of the Linux probably not working because the human resources are not there. There's a question of the brain drain and all that, you know. But that said, you know, there's still a very great hope in the horizon. And we need to look at this much more holistically and together to really get out of this quagmire. Thank you for the good work, the GOIS team, and my very good friend. I'm seeing some quick heads on Will today. I was wondering whether it is Will Ungwa or somebody else I'm looking at today.
Will, he is Will, yes. He's the boss.
So thank you for confirming to me that it is actually Will. You know, okay, thank you, Will. Thank you, everybody. And this is really very interesting. And we look forward to the 3rd January. I'm actually trying to put up my talk together too, you know, to submit hopefully before the year runs out. Thank you, everybody. And thank you for all my folks that I've just mentioned these two just yesterday and day before. And I can actually see all of them here, which shows that the interest is actually catching up, and I hope in the new year we'll have more, you know, to really benefit from this great work that the GOIS and the Global Oncology University team have put together. Thank you, and have a nice evening.
Thank you very much. Thank you. Thank you. We are together. So now is the time for Professor Wilfred Negwa and Professor Susanna to finalize the session. And I would like to remind you, this is not finished by that. All participants who would like, or other colleagues, you just forward it to all your colleagues. We are opening feedback for all, and we have with these feedbacks referred to many experts in the world. So we are in continuous discussion, not just continuous work, continuous building of this movement together. This is not just the session. The session is a method. The course is a method to spread the word. It's not the final objective. So now for Professor Susanna and Professor Will.
Yeah, thank you, Professor Ahmed. Just want to echo Professor Taufik's comments that this was really, and your comments that this was really fantastic to shed some light on the cancer control situation in the Balkans. I mean, we all learned, like Dr. Abba said, you know, being able to share this kind of knowledge and learn from each other, and see where the challenges and opportunities for collaboration are. And for me, listening to those talks, one of the key things that stood out for me was definitely the opportunity for education and training collaborations, which I think is really one of the ways that you can also invest and make it sustainable. And like you highlighted in your own talk, Professor Ahmed, I think we have a good platform here where we can really, also with Professor Susanna becoming the president-elect, hopefully we can find opportunities to collaborate with you around that, continuous education and training. One thing that I would suggest to think about, and I know this is one of the courses that Professor Ahmed has lined up and we're planning a major course on that with the Global Oncology University on artificial intelligence. As you know, that's going to transform the workforce. What is the role for that? How are you thinking about integrating that in your education and capacity building in the Balkans? Because we know that in radiology, people are thinking this is actually going to eliminate some professions that we know, right? So how does that transform? And it's going to create more opportunities. I mean, it's not, they are good and there are challenges and opportunities with artificial intelligence. So, but I think as we think about education and training efforts, it's really important to consider that. So, we are looking forward to the sessions in the new year around that and how that can also be win-win in increasing access to care. So that's one of the things that stood out to me. When Bashkim talked about radiotherapy, one of the key things for me was how, the proton therapy machines and carbon machines that you're thinking of implementing, one key thing that's a win-win scientific approach that's coming up. And I'm actually really involved with some of these, people are looking to invest into that, a lot is in in radiation oncology, the idea of flash radiotherapy, which can really be a major way to increase access to care. So the treatments that we traditionally know nowadays that, patient may have to come in 40 times, that's going to change, right? The patient may only need to come in 1 or 2 times, and that means the time it takes to treat one patient, you can treat 40 for prostate cancer, for example. So as you think about installing these machines, one of the win-win scientific approaches that we can start looking at is how we incorporate that kind of technology, into increasing access to care. So those are key things that I kind of just excited to think about as opportunities for collaboration. And I say this because I know the collaborators we have at Harvard, that can look at, what champions in Flash, maybe opportunities where, I remember when you were in Dana-Farber, Professor Susanna, we talked about some of these things. I think this is the time to revamp those efforts and really work with what Michaela is also doing in you guys in the background. So I think there's a really great opportunity for win-win collaborations there. So looking forward to further conversation around that. Thank you.
Susanna?
Yes. On behalf of the Faculty of Medicine, I would like to express our great, do you hear me?
Yes.
Okay. On behalf of the Faculty of Medicine, University of Pristina in Kosovo, I would like to express great appreciation to Global Oncology University for organizing this session. And given that one of the core values of our school is internationalization and collaboration, lifelong learning, diversity, and so on, we look forward to collaborating with both organizations, Global Oncology University and Global Catalyst in the future. And also on behalf of the Mediterranean Task Force for Cancer Control, I would like to express our wish to collaborating with both organizations, given that our mission is to act across countries beyond Mediterranean region, not only Mediterranean region, but at the global dimension in order to reduce cancer burden globally. And at the end, I wish you Merry Christmas and Happy New Year 2024, and best wishes for all participants. Thank you.
Thank you very much. Thank you very much. And now I'm too glad that we are many participants today, but forward all this to all your colleagues. You are leader, and we are waiting your more and more contribution and leadership in this initiative. And we are waiting with very anxious to hear from you, Will, your exciting lecture in the next part of this course, starting from January, about interesting things about artificial intelligence, about radio biosmart smart radio biomaterials, and all these things as very, 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 very excellent movement forward. So we need always to be forward. I hear here Lydia, and thanks you, Lydia, for contribution. Now we have the time to finish, but it's not finished decision, but we are together online all the time and going forward in fruitful cooperation. Thank you all. Thank you all.
Thank you, everyone. Thank you.
Yeah. Thank you.